Hello and welcome to Chapter 5 on Reproductive Health. I really hope that this chapter gives you guys some truly unique and new information that you maybe did not have, or maybe that dispels some of the commonly held long-standing beliefs that really just are not true. So let's get ready. I kind of warmed us up last week for it. Also keep in mind that this week there is an extra credit discussion board. It is very rare that I give extra credit. So if you are looking to boost your grade, or perhaps you scored poorly on another assignment, this is a wonderful way for you to boost your grade and hopefully get some extra points and do well in the class. So let's go ahead and get started. When we come to birth control and contraception, they're essentially the same thing. There are some minor differences where birth control is essentially controlling the number of children you want to have, whereas contraception is purposefully controlling whether or not you will get pregnant. So that could be used with different forms of ovulation control or spermicides. Essentially, it's all birth control. So I do want to make sure that you know that we use the terms interchangeably, even though the book makes a very, very small distinction between the two. When we look at the percentage of U.S. women aged 15 to 44, and even now that age is kind of going down sometimes to 12 and 13 because the average age of menstruation has declined over the last 25 years in the United States, we look and see that a large number of people are actually using contraception. And at 15, it's kind of alarming because it also means that these young girls are involved in sexual intercourse at a very young age. So we're looking at sterilization, birth control pills, condoms, and other various methods of birth control. There is a very large number of women and girls using this. And so it kind of speaks to the point of abstinence-only education, which some people advocate for. And while I do support educating our young girls and women on abstinence, because it's really the only true form of contraception that will not lead to any STDs or pregnancy, they also should be presented with other options. And even that life happens, people make mistakes, and you do want to have options available for that. And so it just really shows you on this chart how many women in the United States and young girls are using contraception and the various reasons that they are doing so. I will not go over the history because it's just a little cumbersome. You guys can read about that in the book. But race and religion have a tremendous influence. And I want to say a few years ago, there was a large report on CNN and Time, and all the major news outlets were reporting that the Catholic Church, or the Pope, actually was advocating or saying that the use of a condom was okay. Whereas in some religions, they do not view contraception as part of that religion. It's viewed as anti-religion, where if you use that, that is not what was intended for your marriage or your relationship. And so that was a huge aspect of contraception for women who were engaged with the Catholic Church or who claimed Catholicism. And it really kind of made it okay for some of them, and morally, from an ethical and moral and religious standpoint, to go ahead and use things like condoms, because now they had a wider control over the number of children that they wanted to have. When we look at some of the ethnic backgrounds, Hispanic, non-Hispanic, women, Asian, etc., we can really see how the rates of different types of sterilization have changed over the years. One of the things that has stayed pretty high is an IUD. And an IUD has to be put in at the doctor's office. It is long-term pregnancy control. And many of them have had extremely wonderful success. I mean, success in the 90th percentile. The next one that seems to be running roundabout steady but has been on the decline with non-Hispanic Asian women is female sterilization. Now, believe it or not, even though we are in a free country, we are in a blue state, many doctors would not perform female sterilization on women if they were under the age of 30 years old and they weren't married. Or even if they were married, if they were under the age of 30 years old, because the argument was, well, what if your husband wants more children? And that was very infuriating to some women, to the point where we have this thing called medical tourism. Some women were actually going over to Mexico to perform these sterilizations because they were not able to have them done in the United States. And only in recent history has that started to change, where women have been given more control over their bodies. It's not something that you have to ask your husband for permission for. Some women do not desire to be married. Some women desire to be married and have no children. And those are the types of decisions where if you cannot make a permanent birth control option until you are age 30 or over and married, then you may end up having a situation that you really did not intend for. And that can lead to a variety of different options for women when it comes to birth control options, such as abortion, such as putting kids up for adoption. But then we also have to face the reality that unwanted children face a heightened risk of being abused, and also poverty is another issue. And so looking at this chart, we can kind of see the different types of sterilization and birth control options offered to women of varying backgrounds. Now I'm going to skip over to birth control pills, because birth control pills are really one of the most popular forms of birth control for women and young girls. And part of that is not just to control birth. It's also for hormonal balances. Things such as acne can truly be cleared up with some of the birth control pills, even low-dose birth control pills. Another issue of birth control pills relates to painful menstruation, and birth control pills have been shown to decrease some of those painful menstruation times for women. So there are varying options of why women use birth control. And I will use my own mother as an example, and she's no longer with us. But when my mother was a young girl, around the age of 15 or 16, she grew up in an extremely conservative home in the Midwest, and she had periods that would last much, much longer than 7 days, almost 2 weeks, and heavy bleeding, heavy cramping, a lot of fatigue because you're losing blood and therefore iron, which relates to energy. And the doctors told her that if she went on birth control, we're talking mid-70s, early 70s, mid-70s, that it would help to alleviate a lot of those symptoms. And her mother, who was a very staunch Christian, very conservative, told her no. And my mother had to continue having extremely painful, heavy cycles until she was 18, left the house, and then was able to get birth control on her own. So birth control is not simply for just preventing birth. It is very popular for that, but it's also used for the controlling of period symptoms and also suppressing acne. So it's very, very common, extremely effective when it's taken at the right time. So not skipping pills, not trying to double up on pills, extremely effective. And it suppresses your reproductive hormone cycle, which basically prevents you from releasing an egg. And if there's no release of an egg, then there can be no fertilization of that egg. I want to go ahead and not stay on all the types of contraceptives because this is a mini lecture. But the next one I wanted to talk about was hormone delivery. And some of these can be accomplished in shots. I've known multiple women who have had the depot shot. Unfortunately, we have to weigh the scales with some of our birth control. It is known to cause weight gain. Whether that weight gain is significant or not is kind of subjective. Some people say it's between 5 and 10 pounds. Others experience a more significant or dramatic effect. And other women have no side effects whatsoever. So the shot is very popular. And then there's also the patch. This patch has to be worn on the skin though for a week. And then similar to kind of the birth control pill where you take a week of placebo, the 4th week is patch free. And then we have things such as the NuvaRing, which is very, very flexible. It does need to be administered by a healthcare professional, but it's inserted into the upper part of the vaginal canal, and it can be worn consecutively for 3 weeks. It does need to be removed before menstruation, so that's extremely important. You cannot leave it in and then expect it to have the same efficiency after the fact. So it does need to be removed during the week of menstruation. Then we want to look at some other barrier methods that are not as popular, and those are spermicides. Spermicides are essentially used to kill sperm. Sometimes they're used in conjunction with the diaphragm, which is basically a cap over the cervix of the vagina, and the spermicide is used in conjunction with that. It is inserted into the vagina directly before intercourse and helps to kill the sperm inside of your body. So that is another method. Most women, like the slide showed prior, they just prefer the pill because they don't have to do all this. So that's something that you can also be aware of. And then a diaphragm, also known as a cervical cap, it requires a healthcare professional's insertion. And in order to do that, you would just need to go in. It's an outpatient procedure. And this is often used in conjunction with a spermicide. It does need to have a tight seal on there in order to be effective. And of course, before it's inserted, it's always coated with a spermicide or some other type of anti-sperm agent in order for it to prevent pregnancy. And then, of course, we come to the old trusty condom. Condoms are extremely effective. They do help prevent STDs. Not all of them. Things such as genital warts, sometimes it's skin-to-skin contact. So it's not a correct belief that condoms are to be preventing of all STDs. And sometimes that belief has been passed down to us. Well, use a condom. It's going to prevent STDs. It will, but not all of them. Pubic lice can still be passed on. You can still contract genital warts, things that are skin-to-skin contact. So you always have a risk of that, even with condoms, but it's an economical method and it's cheap. They're passed around freely at K through 12 schools, even at the community college setting here. You can go into the student health center and basically get as many as you want for free because it's very easy to administer and it does help prevent pregnancy. They're extremely effective. And then just for some other barrier methods, not as common as the female condom. These, from many women, tend to be a little difficult to administer or to put in. Some of them have noted that they're uncomfortable, and it essentially coats the entire vagina and the genitals. I have not had personal experience with this, but it's not one of the most popular forms. Once again, user error is a contributing factor here, and then personal discomfort. But it is one of the barrier methods that women use. So I've already kind of gone over the risk of STDs with the barrier methods. It also can be used in the event that you forget to take the pill, which happens it's very common. So some women take the patch or the depot shot, which causes them to gain weight. So once again, you kind of got to balance your options there. They are not long-term options, so that is a very good benefit. But some of the detriments are, number one, there's a small risk of bacterial infection or toxic shock syndrome, similar to the extended use of tampons or the heavy use of tampons. So there's always that small risk, but it's very small, but we still have to note it in the con section. And then, of course, it has to be used correctly, and user error is an attributing factor to some of the lower success rates for some of these barrier methods. And of course, the cost is something else. Female condoms are not particularly cheap. Male condoms tend to be significantly cheaper, but sometimes, depending on where you live and depending on your access to these items, they can be kind of expensive. An IUD is the next type of contraceptive device. It's inserted at a physician's office into the uterus. Extremely effective. Extremely effective. Actually more effective than the pill, and the pill's 99% effective. So this is even more effective. It has a wonderful rate of success. It's long-term, and the insertion and removal is also an outpatient procedure and fairly simple. And then we come to permanent sterilization options. Usually when I talk to women about their birth control options, they always say that the man has asked them to get their tubes tied, particularly if they're married. Well, tube tying, it's really not a tube tying. It's really, the tubes are kind of cut and then they're burned at the end. You may have also heard of something called the Assure device, which is now going through a large lawsuit because people have had detrimental effects of that device. So the tubal ligations, there are various methods. One, the fallopian tube can be cut and burned at the end. You can also insert a small metal device. The Assure device has been recalled. So there are a variety of different ways. There's also the complete removal of the fallopian tubes.